Tumors of the lung. So I'm going to give you an introduction to lung tumors. There are benign and malignant tumors. 95% of lung tumors are carcinomas. So, lung tumors, as any other tumor, there are benign and malignant tumors. But 95% of all tumors of the lung are carcinomas, which means that they are malignant tumors arising from the respiratory epithelium. So 95% of lung tumors are carcinomas. Carcinomas of the lung are the most common cause of cancer-related death, both in men and women. As you all know, that the most common cancer in men is either prostate or lung. It varies, but the most common cause of cancer-related death in men is lung cancer rather than prostate. However, in women, the most common cancer in women is breast cancer, whereas the most common cause of cancer-related death in women is lung cancer. So lung cancers are the most common cause of cancer-related death. Although the most common cancer in women is breast, the most common cancer in men is prostate or lung. It varies, but as a cause of death, the most common cancer-related death is due to lung tumors, both in men and women. So how serious is lung cancer? How serious is lung cancer? Lung cancers are found in 13% of all cancers. So all of the cancers that you know about, 13% of them are lung cancers. And 90% of these are fatal. 90% of lung cancers are fatal. So this is a lot. 90% of lung cancers are fatal. Additionally, 50% of carcinomas of the lung present with distant metastases, 25% of them with lymph node metastases. This is on presentation. So it means that in most of the cases, the patients will visit the clinician for the first time with metastases. That's why lung tumors are important, and we are going to discuss them in the coming minutes. So, lung tumors are common, and from lung tumors, 95% are lung cancers. Lung cancers contribute to 13% of all cancers. 90% of lung cancers are fatal. 50% of them present with distant metastases. 25% present with lymph node metastases. So, in most of the patients, they come to the clinician for the first time with metastases. And this thing makes it serious. Lung cancers are usually rare below 50 years of age. So if a patient who is 35 years old presented with cough, it's unlikely that he is having lung cancer. Usually, lung cancers are found more than 50 years of age, and the peak incidence 75 to 79 years. However, there is a variant of lung cancers that can be seen in young age group, and we will discuss this later. But in general, lung cancers are seen in patients who are more than 50 years old, which means that in your clinical sessions, if you see a patient who is 25 years old presenting with a cough and shortness of breath, you can't jump to the diagnosis of lung cancer. All right? So the incidence is rare. It is rare before the age of 50. Peak incidence is 75 to 79 years. There are 4 major histological subtypes. So from lung cancers, there are 4 major histological subtypes: adenocarcinomas, small cell carcinomas, large cell carcinomas, and small cell carcinomas. So there are 4 major histological subtypes of lung cancers: adenocarcinomas, large cell carcinoma, squamous cell carcinoma, small cell carcinoma. For therapeutic purposes, carcinomas of the lung are classified into small cell carcinomas and non-small cell carcinomas. So I told you that there are four major histological subtypes. But we divide them mainly into two main categories. The small cell lung cancers in one category and all of the other three in the other category. So we can say small cell lung cancers and non-small cell lung cancers. The non-small cell cancers include the adenocarcinoma, squamous cell carcinoma, and large cell carcinoma. We divide them into these two categories because they are clinically and genetically distinct from each other, and treatment-wise, prognosis-wise, there is a big difference. And we will come to this later on. Small cell lung cancers are usually associated with high frequency of RB gene mutations, while the non-small cell lung cancers are associated with a high frequency of mutation in the gene P16, CDKN2A. The other thing is, KRAS and EGFR gene mutations are more common in patients with adenocarcinoma within the non-small cell lung cancer category, and they are rare in the small cell lung cancer category. As I said, lung cancers are divided into four major histological subtypes. We divide them into two main categories: small cell lung cancer category, which account for 20% of lung cancers. These cancers are usually central or hilar in their location, with a paraneoplastic effect, and we'll come to this later on. The non-small cell lung cancers, which account for 80% of cases, they are subdivided into squamous cell carcinoma, accounting for 30%, and this is usually centrally located near the hilum. Adenocarcinomas, 40%, and they are usually peripheral tumors. Large cell cancers, accounting for 10%, and they are usually peripheral as well.